So this is Buff, and Buff had a diagnosis of a disease called retropharyngeal lymphadenopathy 6 years ago or so now, which means that the lymph nodes that are up in the throat at the back were swollen, and it was preventing her from swallowing and interfered with her breathing. So she started out on steroid injections, which is pretty common for inflammation, allergic reactions, and lymph node swelling. Even after she endured biopsies of the lymph node and aspirates and achieved that diagnosis. And so the owner came and presented her for acupuncture treatments as a way to minimize or hopefully prevent the need to give her steroid injections all of her life. Buff has responded marvelously well to acupuncture. I think the last steroid injection she had was probably a year ago, and she's been stable, breathing well, swallowing normally, and we've been working on managing her weight and her inflammation with diet. So today we're going to show you some acupuncture points that are useful for this retropharyngeal lymphadenopathy, but also it can be a point prescription useful for asthma in cats, which is not uncommon either. The points can be similar. So we always start Buff's treatment with a little dose of rescue remedy, which, as you can see kind of by the licking and Buff's relaxed state, it just seems to kind of give her a little bit more relaxed for her treatment. The first point we put in here is a very useful point in the middle of the skull called governing vessel 20, and that's a calming point as well. And we put that in first along with the rescue remedy, and then Buff just says, okay, it's time for my acupuncture treatment. The next point we put in is a point over the back of the neck called governing vessel 14, which is right here where the neck meets the chest. And that's a good point for the immune system. And if you notice, the problem in Buff's throat is right in this area, and so this is a good local point for that as well. Some cats will tolerate points on their back, and some cats will tolerate points on their feet. And so far, Buff has been pretty tolerant of me putting needles in her front feet. This is a point called lung 7, which is a master point for the head and neck, which we use because the lymphadenopathy or the swollen lymph nodes are in Buff's neck. That's my girl. This point here is called large intestine 4, which is another good point for the immune system, and the master point for the face and mouth. And since Buff seemed to not mind that point too much, I'm going to put lung 7 here on the other side. So Buff comes in and gets this treatment about every 6 weeks now, and this is what's helping keeping her stable and helping keep her breathing normal. The next point that I'm going to put in is a point here pretty close to the shoulders called bladder 13, and that is a point that is good for the lungs, the neck, and the lymph nodes in this area are connected to the breathing in the lungs. So that's what that point there is for. We're going to see if Buff will let me do a couple little points on her back legs that will connect with these points on the front. And we're going to put a point in here, which you can't see real well. So you'll just have to take my word for it, that there's some points back here for the kidney. And the reason that we use points for the kidney is because in Chinese medicine, the kidney has to grasp the qi of the lungs. And if your qi is stuck here as swelling in the lymph nodes and asthma, you need to strengthen the kidneys to allow that energy to descend. And that's a Chinese medicine principle that we employ when we do acupuncture. And I think that that's all we're going to do today on Miss Buff. Buff is not one of the cats that really likes a lot of needles in her back. So we do points on the front feet, we connect them to the back, and then some local points. That concludes Buff's treatment. Now what we do is we'll leave the needles in for about 10 minutes, and Buff is usually awesome, and she just sits there because she really likes her acupuncture treatment. Thanks so much. We'll see you next time.